Hello, everyone. I am Melissa Fogner. I am the Director of Solution Enablement here at Infinx, and we want to say thank you very much for joining our session today of office hours. We've got a great topic for you today. We're going to talk about credentialing for payers and providers and everything that goes on in that space, which is also going to set up some additional ongoing conversations that we're going to have. I have the privilege of introducing Bo Bowman, who is the strategic accounts for our vice president for our company. Bo, you want to introduce yourself?
Hi, everybody. Thanks for taking the time today. Been with Infinx about a year, and prior to that, have about 20 years in the health system world, working with physician enterprise and hospitals and revenue cycle management. So happy to be here today.
Great. Thanks, Bo. So we're really going to kind of kick things off about talking about the credentialing space. There's a large piece of tasks that have to go along with credentialing with providers and payers. And Bo's got some great expertise, and we've kind of set up some questions and answers to be able to kind of go through and talk about the process. Some of the things to consider when going through credentialing process, it's very task oriented. A lot of things have to happen, not only between creating forms, making sure practice information is completed, and really just making sure that the provider has all the credential information in order to submit to the payer. One of the things that we want to talk about today is, Bo, can you advise us why is it so important for providers to get credentialed and contracted with payers?
Credentialing in general is the very first and sometimes the most important thing we can do to get the revenue cycle for a particular, whether it be hospital, medical practice, dental practice, off to the right start, right? We put as a arguably a healthcare network frame across the United States, we put a lot of investment and a lot of time up front into potentially getting either, again, a doctor, a nurse practitioner, whoever it may be, up and running to provide that access. And the first part that has to be done, is ensuring we're going to have a way for revenue to flow, both from governmental payers, from commercial payers. So, getting the credentialing done early and getting that process started is very important. I would say across the market right now, we're seeing a lot of growth. And so what does that mean? You constantly have a new class of grads, right? You have a class of new doctors of osteopathic, medical doctors, dentists, physician assistants. All of those new grads, every single June, July, and August have to be credentialed on the payers, right? So very cyclical process. That's like one section of it. But what are we also seeing a lot right now? A lot of private equity acquisition, right? So if private equity is out there, either rolling up groups in either, again, the medical or dental space, what happens? We get moved over to a new tax ID, right? Our clients move from one tax ID to the other. They bring on new groups, and we have to re-credential. So that becomes a very important piece. And then just lastly, there's a lot of networks out there today that are just vying for a particular piece of business in a given market. So dense areas, maybe something like Dallas, Texas, Atlanta, Georgia. There are more and more what we call narrow networks that are literally interviewing various types of medical providers to be in their network, and we've got to credential them to be in there. We've not only have to complete their credentialing application, but we've got to show the quality data and why they should be on that plan. So no doubt credentialing is getting more and more complex.
Great, thank you. When it comes to the standard requirements and timeframes for credentialing, each payer, each entity has their own unique process a little bit. So we know payers want to have certain criteria versus another payer. What would you say to the independent versus a large system or even a startup provider practice that needs to go through this process?
Sure. Maybe two ways to answer that question. One, there's not a huge difference. If you're a small, maybe a two-man orthopedic practice that's starting up, or if you're a real large healthcare system, bottom line, you still have to have the basic, forms completed. So the CAQH, that stands for Council for Affordable Quality, you got to have that database repository form filled out. And then there are additional forms, maybe in the state of Texas, where our Infinx Houston office is, you got to fill out the Texas standardized credentialing form, right? So, for the commercial payers, doesn't matter as much if you're large or small. What happens as you progress through that process and the payer actually presents you with a contract, now you're getting into rates. And so, a health system is going to spend more time negotiating rates because they have a large chunk of clinical event that they're providing to a specific group of payers. And so those negotiations can get more complex, and oftentimes health systems have the right contracting offices in place. And then sometimes they could use some research to kind of help them get the lay of the land. And that's another service that Infinix provides with some of the technology that we have today. As for timeframes, 90 days is what we tell our clients that we're trying to get their entire bulk of credentialing going for a new provider. If we're talking about hospital credentialing, which is also what we provide, we work real closely with the medical staff office of that hospital to ensure we're getting all the correct necessary documentation and trying to hit that committee or that board's timeline for review and approval. So we're pretty good about sending updates on if we're going to hit the 90 days or not. Post-pandemic, labor still remains a real problem for a lot of credentialing companies. It's not a problem for Infinix today. We've got strong labor forces, and we're ready to meet those deadlines.
Great. So let's dive into a little bit about that technology piece that you spoke to. Infinix has, technology and automation in place to help with this part of credentialing the providers for the payers, as well as the team plus tech approach. What would you say some of the things in the technology and how we're able to accelerate that in our automation for this type of product that we've got?
Sure. So, as we start getting into, say, maybe some of the larger single specialty groups out there, or even large conglomerates of say, surgical hospitals, now you're talking about doing credentialing on a grand scale, right? So large radiology groups, large anesthesia groups are good examples. And so now you're talking about having to move 1,500 providers, maybe from one tax ID to another, or maybe, again, kind of back in the private equity world, we may be closing down a tax ID, starting a new one, having to move and get on some new contracts. So I think what we can bring to the table is not necessarily a full-blown robotic process or something like that, but think of it more of as an algorithm, right? We can train our technology processes to go check portals, all the different portals that we have to check with each payer, to get status updates on where maybe either each facility or where each doctor or where each nurse practitioner is in the process. And as we're able to kind of keep up with those algorithms and report on those back to the client can have security and know that, hey, not only do we have a strong and intelligent labor group that can track each process and each place of where we are in the credentialing journey, but we also have a little piece of technology that is actually very powerful and will allow us to give up-to-date, notices on where each provider is in the process.
Okay. And that really equates to efficiency and proficiency and decreasing the manual effort that's going on in the doctor's offices. If they were doing this on their own, they're taking away time from seeing patients or, helping the physician going through all of these things. So talk to me a little bit about our clinicians and our practitioners and how this can help them, especially with our service, and, reduce some of that manual effort that they're having to go through so they can focus on what's more important, the patients.
So we'd really love to be, we really kind of think of ourselves as an internal partner, right? We want to relieve the staff. We want to relieve the providers. We want to relieve the administrators. Even oftentimes, smaller practices, again, medical, dental, they may have to outsource it to a law firm, a contracting service, stuff like that. You start getting into very high hourly rates for services like that. So we don't think of ourselves like that. We don't think of ourselves as a vendor. I would say, in that credentialing space, you want to feel like you have an internal partner, that it's as simple as, oh, I received an email from a payer, not sure what to do with this. I'm going to forward it to my rep, right? And from there, we start the process of assigning that task to one of our associates, and then the follow-up process goes. So whatever, if we're using a project management software, or whether it's just a manual process that maybe we're tracking for a small dental group, then we'll work through and we'll do, kind of weekly updates with that group and show them where we are in the process with maybe that set of 5 or 6 new health plans in town that they want to be on, or a separate DMO that's new that they need to get all their dentists on in a, maybe a short amount of time. Maybe it's a limited time frame. So again, just want to take the worry and the burden, off the group across all levels of discipline in the practice.
Yeah, I think I've heard in some of our meetings, we talk about the white glove service that we're able to provide. And I think that was a really great way of saying that because we want to take that burden off of the staff that's going on in the doctor's offices. So it's really important for us to develop that relationship with our providers, with our clinicians in order to go through this process, because it's not simple, right? It takes time and there's a lot of back and forth that has to happen. Any other key topics to bring to that as far as the service that we provide and how, partnership we are with our physicians?
Sure. White glove's a neat term. I also like the term boutique. I mean, we really, excuse me so much, we really try to be kind of boutique and unique to each specific client that we serve. So again, whether it's a 2 or 3, maybe a husband and wife gastroenterology group, and they've just started their own imaging center, and they've got to go out there and, get everything squared away with the payers, so they can start booking. And so they may have to do some facility credentialing. We can handle that too. Right. And so we try and tailor the services to each client's needs. So, if that's 2,000 anesthesiologists that are moving a tax ID or that are going into a consolidation network and everybody needs to be re-credentialed, then we can take on a scale of that size. If not, then we'll tailor it to something unique that, maybe the client needs. And I think that's a, kind of a special thing that we offer that, maybe our competitors don't.
Great. It's great to hear. It's also, one of the many things that Infinx does for their customers across the board. We're very customizable and able to tailor our service to them. When we think about the key components to think about during credentialing and also during contracting, what are some of the roadblocks that our providers and the team run into to overcome?
A lot of payers are still challenged with their own labor teams. So, definitely during the pandemic, post-pandemic, and I can't believe we're still talking about that. But, long story short, not uncommon today to finish your CAQH, finish all the necessary credentialing forms, submit all that online for, maybe a new, for a provider dental office that we're bringing up. And then we check back in a week and there's an expectation that, something will have moved, or maybe we'll at least get an email that say, hey, we're processing your application. We'll be back in touch. And, nothing's happened in 5 days. So, again, what do we do about that? Again, unique boutique labor kind of approach. And that is, hey, if they do leave a phone number, then we'll go ahead and schedule a call. We won't say, hey, when can you meet with us? We'll go ahead and schedule a call, start to be a little bit more aggressive with the issue because, we know time is money. And, if we don't get the providers credentialed on time for, what we've been contracted to do, it can be a real, challenge. So, the payers having their own labor problems, we've run into that, and we've just had to partner with them and try and, be as conservatively as aggressive as we can. Another piece of the equation is not having all of the correct information up front. So for all of our, maybe potential clients or folks that are listening today, part of the problem with credentialing is just getting organized, right? So we'll come in, we'll help the client get organized. And if that's just reviewing their spreadsheets or maybe taking a half day of trying to see how they have everything organized and what they do when they get a request in and then go from there. Well, a lot of times you can get through an entire request list and then start the process of the actual application, but there's like 17 pieces of information that we still needed. So making sure you're organized both on a client and kind of vendor relationship is very, very important. And honestly, getting everything organized and getting the necessary information in to get the applications done is 3/4 of the battle.
Yeah, I noticed in looking at some of the credentialing checklists that we have, management documents, transcripts, licenses, certifications, recommendation letters. I mean, the list goes on, and that can be definitely overwhelming for an entity to deal with. It's even, looking at continuation hours and make sure those are mandated and kept up to par. How do we also help the providers be proactive in those pieces and making sure those things are happening either during or pre-setting up for credentialing and contracting?
Great question. So we've really installed the discipline of building client profiles and client portfolios, right? So we have a folder on every single client, and don't want to really use legal or legalistic terms here, but again, back to organization, right? It does become very, very important on how we're organized, right? So we'll have one portfolio for one provider. And whether that's times 1,000 or times 600 or times 50 or whatever we're doing for that client, what we'll try and do is standardize all of those folders, right? So whether it's using a spreadsheet system that the client prefers we use, or whether it's using our own technology, our own systems, we'll go across all of those folders and make sure every single one has every piece of documentation, all the way down to, hey, if we're either credentialing or re-credentialing a new cardiothoracic surgeon, then yeah, we have to have what his or her caseload was during their surgical training, during their surgical residency, right? We've got to have, every single piece they have to, to qualify on that potential payer plan. Another big, piece of all of that is, just because we've submitted the application, maybe to Aetna or one of the big payers, doesn't necessarily mean the payer is accepting new applications for a general zip code or geographic area. So then what do we do about that? How are we proactive about that? Well, we can take over the letter of intent or the letter of inquiry process for the client. One less thing for you to worry about. So we do have templates for various LOIs, and we'll write them up, review them. We'll send them to the designated signature authority for the client, make sure they feel comfortable with that, and then we'll submit those LOIs. And again, whether that's re-credentialing on a new plan, whether that's getting involved on a plan that's in town, and we want our client to be inside of that narrow network, then we'll work through with the client on that. But we'll always try and be proactive and make sure that the client's just not left, well, how did I not get on that plan? But my three competitors down the street did, right? So we'll kind of have our ears up for that type of impact.
Yeah, that goes right into my next question and topic was market expansion. That's a prime opportunity when we're going through that exercise to develop the areas around the physician's area to be able to expand and reach more patients. So it's really a great, win-win for both. One of the questions that came in through the chat is, how do we help with negotiating new payers and making sure that the fee for service and our negotiated rates are, equal across the board or with different payers? How do we look at that for providers?
Right off the bat, the payer is going to look at a history of claims, right? So kind of moving back over to the RCM world for a second. When a payer can pull the claims history for a given provider or a given ownership entity, right off the bat, they're going to place, that particular medical entity, again, medical, dental, surgical facility, whatever it is. They're going to look at the claims volume. They're going to look at what was paid out, and they're going to automatically kind of classify you into a category of rates that they're willing to pay for those services. So I want to be real upfront. I think with some payers, there is almost little to no negotiation room because they may be so large and so influential in a given area. Blue Cross Blue Shield, for instance, in the state of Oklahoma and the state of Texas, right? Very difficult group to deal with. But in other states, Blue Cross does not penetrate as much, and there's ability to grab a percentage above Medicare for your allowables, just depending again on what you're doing. I think another piece of it is the scope or the breadth of the type of services maybe a potential health system or a potential surgery center group may offer. And so if you are improving patient access, right, very important term, if you're a health system or surgery center or, kind of back in the dental world, if you're putting together a large scale entity of dental offices and you're improving access, then that is also another negotiation point with the payers, right? Where you can say, well, we're opening up 13 different access points across these, particular zip codes. And then, the payer has to come back and say, okay, well, we're going to have to pay you X for that. And you start to gain a little bit of the leverage with your own internal economies of scale. Now, maybe kind of back on the smaller, whether it's a 1 to 3 man or a 5-man, say, orthopedic group, that's a little tougher negotiation, right? You're going to typically receive the rates that are available for smaller groups in your area. Well, so then you go and say, well, how can then I get an advantage on my payer mix and start achieving a little bit more above the Medicare allowable? It's kind of back to the narrow network conversation, right? You want to see what the new health plans are that are coming out. Every fall, we have new Medicare Advantage plans. I think it's important to analyze those rates and see how many of your providers you can get enrolled in those plans, because they'll push new patients to your practice pretty quick. So there's a lot of different ways to go about it. And then, we're happy to come alongside and provide some of those analytics for you.
Great. Again, anyone that wants to bring in any questions into the chat, we are more than happy to address those. Feel free to post those in, and we will definitely get to those if we have time. If there's anything you wanted to point out, Bo, about this entire process, what would be your, thing that keeps you up at night when it comes to this credentialing and contracting process?
So back to timeline, right? Timeline's the tough one, right? Because again, we have, significant clients that have made significant investment in either an upstart, a new start, or, they're just in general growth mode. So, they've projected September 1st, we're going to have this particular facility open for business. We're going to be advertising that we're on, say, these 4 or 5 major plans that are all employer based. Again, you run into, maybe a town that has a lot of manufacturing, and most of the folks that live in that town are on 1 or 2 or 3 of those health plans. Well, that's where we can come alongside of you and say, okay, we're going to prioritize these top 2 or 3. We're, back to it, right? Whole spectrum here. We're going to organize your data. We're going to organize all your certifications. We're going to complete all your forms, and we're going to focus on those 3 plans to ensure that, hey, that covers, say, whatever, 75% of the population in those 25 zip codes, right? So we're going to take an analytical approach to try and beat that 90-day kind of industry standard. So, but, it's tough. It's tough if you can't hit the 90 days and you can't, kind of look your stakeholders in the eye and say, hey, we're not going to be quite ready to roll on the day we thought because of X. You don't want credentialing to be the reason. And so again, it takes a lot of determination and a lot of organization and focus.
Okay, great. When a provider wants to get started across the board, whether new, not, what would you recommend, not only reaching out to Infinx and having that first initial conversation, but what would you ask them to prepare for and to look at when starting this path of credentialing?
So, right off the bat, we'll do a little bit of a due diligence discovery call. Whether again, small or large, we'll want to look at a list of providers. And, we need most of the certification documents behind each of those providers, all the way down to, maybe when the last time they were credentialed on a potential plan. From there, we'll make kind of a Gantt chart or a timeline plan, and we'll kind of show you either by provider or by facility. Once we help you get things organized, on when we will put together kind of a stoplight report for the client, and you'll be able to see kind of each week a pending status on since what we got started on, how we filled out the necessary forms. Again, that designated signature authority for the potential client, that's important. So we'd like to have an actual either face-to-face or virtual meeting with the signature authority, because we'd hate to have, say, 30 or 40 credentialing applications out there that quote unquote still need to be signed. So again, it all sounds so simple, but we're very, very, very busy. And so, remembering that, we have to walk through the various disciplines to make sure an application is what I call firm and final and out the door is really what we do well here. That if you're not just focusing on that and you are distracted by all of the other things that have to get done in a general, healthcare environment in one day, it can be very difficult.
I remember a couple of weeks ago, we were having a conversation with a potential customer that had not been credentialed in the past. They were a concierge type service, and they were looking at their physicians across the board, multiple states, and really just trying to wrap their heads around where to start, what to do for all of their physicians, especially that were cross bordering states. They were trying to identify what the value add would be for not only their patients that they were servicing, but how they could bring in more value to their organization with reimbursement from the payers. What would you say to organizations like that are really out there booming with their concierge service, the telehealth, but they haven't been contracted for any of their services because everything's self-pay? What would you say to help them, kind of lean towards looking at with credentialing with payers?
Yeah, I say the good news is, both CMS and then many of the commercial payers, Blue Cross Blue Shield, Aetna, United, Cigna, they've kind of followed steps. So, the good news with telehealth these days is the bulk of the consultation codes that are used in telehealth are all reimbursed, and they're starting to be seen as, if you will, more common way to see the provider. And that's one thing we have the pandemic to thank for. So that's interesting. That said, contracting with the providers, with the payers, depending on the size of your organization, can be a little tricky. So if for instance, you're a new, say 6 provider mental health group that has the entire spectrum, and you want to get on a few of the plans, some of the competition around there is going to be interesting because payers will limit how many providers that they potentially bring on for an area. So again, where can Infinix help in this? We can show you in a given population, or say a given state area. We've got very specific data, for instance, in the state of California, the state of New York, the state of Texas, where the density is of providers. And so if you're trying to bring on a significant virtual health group where there is already 5 or 6 significant virtual health groups that are having their claims processed by, again, say, Cigna, Aetna, or United, getting on those plans is going to be a little bit difficult. And so we'll help you with that analysis, and we'll show you up front. And then from there, we can kind of maybe help the group navigate to say, okay, we can be more impactful if we have our set of providers, doing this level of service. Now, again, virtual, you can kind of call from anywhere. Well, at the end of the day, we still have to submit claims with an address, right? And we still have to attach that back to a credentialing form. But, I would urge, any of the new telehealth providers to, start somewhere. What does that mean? Well, you can consult us. We can get all of the credentialing forms completed and say, we can start with a small chunk of what it is that you guys want to accomplish. Maybe 3 plans, right? The 3 biggest plans that pay out for telehealth in that area. Let's get 10 providers credentialed on that, open up access, and we'll kind of measure, say, 90 to 180 days how that goes. If access is improving, claims are getting paid, you're getting 5-star reviews from the patients, then let's do 10 more, or let's do 20 more in either the same area with the same plan. So those are the types of services, again, that we can kind of tailor to what a client may need.
Great. Well, Bo, thank you very much for all of your information. It was very informative. I hope all of you that joined the call today found the same information helpful for you in your practice. As usual, on every Thursday, we do these office hours. We're going to be adding some additional credentialing calls over the next few months. If you have any topics or ideas or would like to participate, please let us know. Come to infinx.com. Again, want to thank you all for your time today and the questions that came through. We will see you next week. Thank you again.
Thank you.